Aflao, a bustling border town where community and family ties run deep. Meet Christian Nyalete, a 38-year-old driver whose life took an unexpected turn when he was diagnosed with tuberculosis. Little did he know that his diagnosis would not only test his physical resilience, but also challenge the bonds within his family.
First, I sick, and I take it like normally sickness like malaria. And first I'm at Accra, and I drop down here. I come and go hospital at Agbozume, and they say I should come to the hospital here, what they call it, Michigan. And I come, and they come and do the test for me, and they give me, and the doctor tell me that I have a coughing, like a door.
Christian's world crumbled as he faced a heartbreaking reality. The very person who should have provided comfort and support, his own mother, turned away. Stigmatized and isolated, Christian was forbidden from sharing meals with his family, a painful separation that extended to his own children.
I go to the hospital, and the doctor give me the medicine, and I come and explain what sickness that worried me. Oh, now my mother changed her lifestyle to me. And now if I speak, my mother will be shouting, hey, Christian, hey, I told you not to be spitting at the public, so I should go outside and go and, oh, even if my children come back to school and they come closer to me like that, hey, if my mother can meet, hey, then we'll be calling the children that they should not near me. They should not near me. They should not near me, so they don't know that this is the sickness that is worried me.
Amidst the darkness, a glimmer of hope emerged in the form of TBImpactGH, a digital tool designed to empower those affected by tuberculosis.
One day we can go meeting, and I tell Sister Joy that how my mother will be behaving to me, and one day, and Sister Joy called and explained how the sickness is this. But before she calmed down, and like now she can do to me.
Christian was linked to a TB advocate through the TBImpactGH app. That would change his life for good.
I got to know Christian through the TB disease. So as a TB advocate, we go to the hospital, we take names of clients, then we do contact tracing by visiting them, educating them, motivating them to take their medicine to get better.
I thank them. If it could not be them, like by this time, I don't know where I'll be. And me, how the sickness catch me, you know. Even my fellow people, my friends, I'll be saying, hey, Christian, ube. And I feel so sad, you know, to myself. But as I come and I come and collect the medicine, and I've been drinking it, eating in normal time, doing everything, I can see that I'm fit.
Introduced in Ghana in 2022 by Hope for Future Generations, the TBImpactGH has become a beacon of change, breaking down barriers, challenging human rights violations, and confronting the pervasive stigma associated with TB. This has reduced the TB mortality rate, especially in the 9 high-burden districts in the Volta, Central, and Greater Accra regions.
And when we diagnose the people of the condition and they get back to their various homes, because of the stigma that is attached to the conditions, they don't follow up in terms of taking the drug. They don't want people to be aware of the conditions they have. So the the intervention of Hope for Future Generation has actually created some awareness among the community members, and this is yielding a good result. Our defaulter rate has reduced drastically, and the rate at which people are dying in terms of the disease has also reduced. So it's a sign that their contribution in terms of support to the clients in the community is very laudable.
Hope for Future Generations established TB support groups within all 3 implementing regions. These provide a very good platform for TB patients to share their experiences and support each other. It is also collaborating with the district health management teams to sustain the support groups even after the project.
The activities they've carried out in the municipality has actually helped us in getting a lot of people to voluntarily come for screening, and some were found to be positive and have been put on treatment. It has actually helped us to even exceed our target for this year. As a municipality, we were given a total of 120 cases to find within the year 2023. We were able to get 148. That is about 123% of our target. We have exceeded the target.
Please, we are pleading. We are on our knees. This Hope for Future Generation program, it shouldn't come to an end. Please, we are on our knees. We have our brothers and sisters in the community who are also going through the same thing we went through, which is the TB disease.
The TBImpactGH appears to be the game changer in addressing challenges, preventing patients from receiving treatments. Hence, the push to have the initiative go nationwide.
It's a software that the country must adopt. It's very important because it also helps you to track the quality of work that you are doing. It gives opportunity to the people to engage you, to let you know that what you are doing is helping us or not helping us. It also contributes to efficiency and effectiveness of your work, which is very important, especially at this difficult time where resources are limited.
Yomekpe, translated as the cough that leads one to the grave. This gloomy local term not only describes the disease, but carries with it a heavy burden of stigma, influencing the perceptions of those affected. But, thanks in part to Hope for Future Generations and the TBImpactGH, the name has been changed to PSS, which means hard cough, which can be cured through a 6-month treatment regimen. Emmanuel Jivenu, Joy Prime.
Welcome back on the AM show. Now, each year, on the 24th of March, the world marks World Tuberculosis Day. It's a way to commemorate or to join hands globally to propel the fight to eliminate tuberculosis. According to the World Health Organization, about 1.5 million people lose their lives to tuberculosis. It poses a significant global health challenge, particularly in sub-Saharan Africa. And as our way of marking World Tuberculosis Day, we are going to have a conversation. I'm joined in the studio by 3 wonderful guests. Emmanuela Kwame, Programs Manager of Hope for the Future Generations. Dr. Yao Edusupoku, Programs Manager of National TB Control Program under the Ghana Health Service. And Anthony Echia, who is a community member and someone who's been affected by tuberculosis. Ladies and gentlemen, it's a pleasure to have you here in the studio. Good morning to you.
Good morning.
How are we all feeling?
Very well, thank you.
Right. So let me start with you, Dr. Edusi. According to the World Health Organization, it says about 10 million individuals worldwide are affected by tuberculosis. What is the case for Ghana?
Thank you very much, sweetie, and good morning to all of us. Yeah, so for the case of Ghana, every day, 30,000 people fall ill. Every day, so for the case of Ghana, every day about 121 persons fall ill, and then every day about 30 persons die.
From
Clearly,
tuberculosis.
from tuberculosis. So really, it's threatening to society, and we have to do something about it. It's not that we cannot cure it. It's about advocacy. Have I heard it? You see the tape that was rolled out. This is a guy who is in a village, who is minding his own business. I mean, trying to get something going, and then he starts experiencing symptoms. He doesn't know what it is, but thankfully, he heard something from either on TV or on the radio, and then he came to the health facility. He was assisted by the community. One of them is the Hope for Future Generation Advocates. So you see how it goes. We can cure TB.
Right. And in that regard, the TB control program under the Ghana Health Service has partnered with Hope for Future Generations to create awareness, to stop stigmatization, and really just educate communities about what this disease is and assure them that it's not the end of life. Also in that same line, you've developed an app. Could you please tell me a little bit about that app, Madam Kwame?
Okay, sure. So Hope for Future Generations brings in the civil society perspective and contribution to the TB response in Ghana. And as an NGO, you know we are donor-driven, and so supported by Stop TB Partnership Geneva, the global community was able to come together to develop an app to specifically tackle the gaps in TB implementation worldwide. The app, which is called TBImpact globally, but it has been adapted in Ghana as TBImpactGH. And so every information on the app mostly was generated by the National TB Control Program, and then civil societies coming together to put those information there. When we look at some of the challenges being affecting the TB community in Ghana, it includes stigma, it includes discrimination, it includes barriers to TB services. And so looking at how can we address these gaps, because they have existed for so long. So the TB community members, we as an NGO, we are people-centered. And so we decided that to be able to put people at the center of the implementation, let us develop or let us adapt this app from the global community that will encourage and empower the TB-affected people to lead the implementation by themselves. So this app is to monitor how TB services are delivered in Ghana in terms of quality, accessibility, availability, and even affordability.
Right.
Right.
I'll circle back to you both, but I want to speak with Anthony. You have been affected by tuberculosis. Could you briefly share your journey with us since you first suspected that something was wrong and treatment to the point where you're here to share your story to the world?
Okay, thank you very much, and thank you to our viewers. Most of the times when you get affected by TB, you often don't know that you are contacted TB. You have to call for some time, go to the pharmacist, get some medications, take in the medications for if the cough is out of your system, then you know that, oh no, it's not tuberculosis. But when the cough persists for some time, then you know that and you get a good health facility or through the community, you have information on what your next steps are. That's having a sputum check. Then you are identified and you know that you have tuberculosis and you are linked to care, as in to a health facility for treatment. And the duration of the treatment for mine was 6 months at a time. I had to take medication every day at the dot service or the dot center, and for them to monitor and for me to also adhere to the medications and taking them and getting well as well.
Dr. Idusi, do you have these programs all over the country where each community can have access to programs or activities that sheds light on tuberculosis so that they can at least take their health seriously?
Thank you very much. Yes, we do. No, we work with NGOs. If I say we, the health workforce.
Ghana Health Service?
Ghana Health Service. We have some NGOs, they are not in all districts, who also find cases. Some are in the hard-to-reach areas, very difficult terrain, but they have decided to be there. And then some are also, as Anthony is one, we call them the community-affected persons. They are very good in counseling because they've once been affected before and they have been cured. So, I mean, they align themselves well with people who are on treatment. And so we get less and less default rates. It's very important to collaborate with all these people, especially around this time when we are marking our World TB Day, 24th of March, but we are commemorating it on the 22nd on Friday, which is tomorrow at the Jubilee Park. Look at what I'm wearing. Yes, we can end TB, and that's what Elatu is wearing. Why? TB is not just a medical issue. It has a social component. It's a social disease, you know, and it has a component of stigma, high one. If people get it when they are in overcrowded areas, some people sleep in kiosks, about 10 of them, prisons, and then if you don't eat well, you will come down with TB because you breathe the germ in the atmosphere. Somebody breathes it out. When the person sings loud, sings or shouts or coughs, and then you also inhaled it.
So I think we should bring it all the way down. Tuberculosis is an airborne disease, correct?
Excellent.
Exactly how does this germ act? And how does it get transmitted? And who is at risk?
Very good question. How does it act? So it's from a person who is already infected. The person is expressing symptoms. The person sits on the trotro, so we are all at risk. Right now, if we disaggregate our data, all professions are in, including the health staff. The health staff belongs to the at-risk population, the vulnerable group. So on the vehicle, in the classroom, when teacher is teaching, somebody is coughing, teacher must be able to indicate that, look, I have to let your parents know that you need to go for screening. So you see, exactly how does it come about? So we breathe in it, but we breathe this germ and then it goes into our body. Some hide. It hides for a long time, sometimes 10 years, sometimes 5 years, sometimes 8 months. It depends on your immunity. If you smoke, if you drink, you bring your immunity down. If you have HIV, you bring your immunity down. And so these germs come up. So you start expressing some symptoms like fever. Anthony mentioned it, fever, chest pain, weight loss, drench, you sleep, and everybody is not sweating. You are sweating profusely. So these are some of the chest pain. These are some of the symptoms.
And the only way to know for sure is to be screened at a hospital.
Very good. We screen at the hospital, but we also have his organization, for instance, who also screen them in the communities.
But screening is the only way to tell.
Screening,
that you have...
two main types that we do. Okay. It's the symptom screening and then the X-ray.
Okay.
It's very, very, very critical. We have them. We have the digital X-rays, as many as about 79. And then we have the gene experts that test the sputum, about 200 of them in country. But they are not enough, and we have some strategies that we use, like transporting these sputum samples from areas where they don't have the gene expert to areas where they have the gene expert. It's a machine. Within 2 hours, results are ready. But before, as he indicated, before he was diagnosed, he went to the pharmacy to buy medicines for cough. And that is what a lot of people do. Some also have to buy chicken and then take it to the soothsayer, okay, because they don't believe that it is curable. So these are the misconceptions and the myths that come with it that we need to. But we need to have the collaboration political world. When I say political, it's not a seat of government. I'm talking about the chief executive officer in a district who will stand and say that, look, all persons who are coughing, go to my district hospital or go to my health center. We will screen you. Or the MP who is in the constituency and say, look, I'm campaigning. This is my mantra. Go to the hospital, the health facility, and get tested. This is the way to go. The teacher is teaching and then realizing that some are chronically coughing. So everybody, and you are interviewing us, people who are watching us, they will go to the health facility for screening. So it's a work that we all need to do.
Okay. Emanuela, I know this cannot be overemphasized because it's very important, but why did Hope for Future Generations decide to actually focus on tuberculosis? And could you share some success stories with us on some of the things that you've been able to achieve,
Yes.
through your awareness programs?
Yes, okay. So being an NGO, we seek to improve the health of vulnerable populations. And so if people are marginalized because of their health, which for conditions such as TB, which is purely preventable and curable, Hope for Future Generations, we care about community members. And so for us, we think that we can take on interventions to prevent and then also to improve the health of these people. And so we get to the grassroots, the remotest places as possible, where sometimes Ghana Health Service cannot even go. We also have our resources to augment what Ghana Health Service is doing. And so, especially with bringing the app in question on board as well, is also to ensure that the people most affected by TB are the ones leading the implementation of the response. What does that mean? It means that people are meaningfully engaged to bring on board their view of what can be the most effective solution to end TB in Ghana. So for Hope for Future Generations, that is what we do, and it's been very beneficial. Through the app, we have been able to have about 1,000+ people engaging on the app. These are people affected by TB who are reporting issues such as stigma,
right,
issues such as discrimination, issues such as lack of nutritional support and lack of financial support. And for some of the success stories, recently there was a case of a student in Central Region who was sent home because he was on TB medication, which is not right. For TB, doctor can attest that for the first 2 weeks of having been diagnosed of TB, you are infectious. But once you are on treatment and then you pass the first 2 weeks, there's a huge reduction in the infection rate. And so the possibility...
So it's not transferable at that
point, yes, the possibilities reduced.
Okay.
And so if someone has gone past 2 months of TB treatment, why do you send such a person home to go and sit home?
Because they don't know.
For 6 months, exactly. And so that is where we come in, first to advance the rights of these people. So we had to engage the school because we think that they don't know, like you said. We engaged the school to let them know the right thing to be done. So at the end of the day, the student was brought back. And another thing that was also asked was for the student to even bring their medical records so that they can file that on the students' records in the school, which isn't right. And so for some of these things, that is where we come in to intervene for the client.
Anthony, I've heard a lot of the word stigma and discrimination used a lot. As someone who's been affected by tuberculosis, did you experience it, and how did you navigate that?
I also experienced TB stigma.
Okay.
See, at the time when I got my TB stigma, my elder sister is a health worker, and she will advise you, hey, this TB, you shouldn't bring it close to us crowd. You should isolate yourself, take more fruit, be drinking water. Even the cups and the spoons, you will not be using the ones that your family are using because you are afraid that they will get affected by the tuberculosis as well. And when you go into vehicles and stuff, the moment you cough, everybody's looking at you. Although you use a tissue to cover your mouth from other people getting infected, they don't understand that you are you have passed your 2 weeks and they will not get affected, but you are doing your possible best. But once they see you coughing, everybody will be looking at you some style, and it's not comfortable.
Coughs are uncomfortable when you're around people. But it's a step in the right direction. This, I hope, sheds more light on this issue when people understand that tuberculosis is not a death sentence, and we should not discriminate against individuals who are treating stigma. So, in about 1 minute, we need to wrap this up. Any final words, considering today we are marking World TB Day?
Thank you very much. So, for the first time in this country, in 2023, we notified over 19,000 cases, as against 2022, which was about 16,000. So the disease is there, and it affects the workforce of this country. People are laid off work. They don't, because you have to treat for so long, they are unable to go to work, and the stigma as well. So we need resources. I told you, the first line of diagnosing this is using the gene expert. The gene expert is 200. We have the 200. The district we have is 261. So there's a shortfall. In this gene expert, we use cartridges. One is $10. So we need resources from government, resources from private. We need all this. Together, we need to partner with media. And so we want to thank your station. It's real. We need resources. We must all come together. Thank you.
Well, Emanuela,
Yes.
how do we get access to this app? Because obviously it's the first step towards a pool of information and how to even navigate the world of tuberculosis. How do we get this app? And then you can wrap up with any final words you want to add.
Right. So the TBImpactGH app is downloadable on Google Play Store and then the App Store. So once you get there, you can, and then you go through the registration and you can have access to all the information on the app. We also have a toll-free number that you can reach us on for TB counseling, psychosocial counseling services. It's 0800 457 231. Should I take it again?
Yes, you can take it again.
Okay, so 0800 457 231. So you can reach us on the toll-free number, and then we can assist you with all the support you need to go through your TB diagnosis and treatment.
Okay. And finally, Anthony, what would be your message to all those watching you with tuberculosis, someone who's never even heard about the disease before, as someone who's been affected by tuberculosis? And you're okay now, though, right?
Yes, please.
Yes, good. Okay.
So my first thanks goes to my organization, Hope for Future Generation, for giving me the opportunity and for granting us capacity building and strengthening us with the information and knowledge about tuberculosis that we need, that we will be able to carry out our messages across. And also for the TB community, which I'm a part of, we should continue to have the information, create awareness, and share. I think through each Hope for Future Generation, there are support groups now that have been created so that we can communicate between ourselves and give ourselves morals and strength to be able to adhere to treatment, stay safe, and be as in cured out of the TB disease as well. So, like, there is hope,
There is hope, right? So it's not the end of the world if you have tuberculosis. Emanuela Kwame, Programs Manager for Hope for Future Generations, the organization, non-profit organization, creating awareness and making sure that every grassroots communities where, like you said, Ghana Health Service cannot go, they understand that tuberculosis exists, but it's not the end of the world. And Dr. Yao Edusipoku, Programs Manager at National TB Control Program under the Ghana Health Service. And then Anthony Echia, member of the community and an advocate for tuberculosis. You were my guest. Thank you so much for staying for this conversation. Up next, there's more. Please stay with us.